If you're over 50 and noticing a drop in sexual performance, you've probably heard this one. Take a nitric oxide supplement. It boosts blood flow and fixes ED naturally. It sounds simple. It sounds promising. And it's being pushed everywhere. YouTube, health influencers, supplement companies, even some medical clinics. But does it actually work? Or is it another overhyped idea that doesn't survive contact with real evidence? Today, I'm taking a critical look at nitric oxide supplements and whether they truly help men over 50 improve sexual performance. Before we talk about supplements, we need to be honest about what's happening. Most men over 50 experience weaker erections, slower arousal, less reliable performance, lower stamina, a gradual decline in drive, and a major reason is reduced blood flow, partly because nitric oxide, the molecule that signals blood vessels to relax, naturally declines with age. This is where supplementation enters the picture. But the question isn't, does nitric oxide matter? It's, can supplements reliably boost it enough to improve sexual performance? And that's where the claims start to fall apart. The typical marketing pitch is increase blood flow naturally, restore youthful sexual performance, boost nitric oxide instantly, and a safe alternative to ED medication. They often contain ingredients like L-arginine, L-citrulline, beetroot powder, nitrates, proprietary blends with names like TurboFlow or VasoBoost. Influencers talk about them as if they're guaranteed to work. The problem is, biology is more complicated than supplement ads. Here's where things get interesting. 1. L-arginine alone rarely works for older men. Multiple studies show that L-arginine on its own is poorly absorbed, and aging blood vessels don't convert it efficiently into nitric oxide. For many men over 50, L-arginine has little measurable effect. 2. L-citrulline performs slightly better, but still inconsistently. Some research shows that L-citrulline raises nitric oxide more reliably than arginine because the body converts it more efficiently. A few small studies did show mild improvements in erection hardness, but these improvements were modest, inconsistent, and often temporary. 3. Beetroot and dietary nitrates can increase nitric oxide, but results vary. Foods like beetroot and spinach do raise nitric oxide levels, but here's the issue. The increase is usually too small to reverse age-related ED unless the ED is very mild. 4. The placebo effect in sexual performance studies is enormous. Across ED research, placebo groups often show 20 to 30% improvement simply because sexual performance is strongly influenced by anxiety, confidence, expectation, stress, arousal, environment. So a supplement needs to outperform placebo in a meaningful way, and nitric oxide products rarely do. 5. ED after 50 is rarely a nitric oxide problem alone. For most men, it's a blend of reduced testosterone, impaired circulation, nerve sensitivity, decline, stress, metabolic changes, sleep issues, inflammation. You can't fix all of that with a single molecule. Nitric oxide supplements are usually marketed as totally safe, but there are risks: headaches, dizziness, low blood pressure, interactions with heart medications, worsening reflux or stomach issues, and for men taking PDE5 inhibitors like Viagra. Combining them with nitrate boosters can be dangerous. This is almost never mentioned in influencer videos. So, what actually helps? Improving circulation overall, exercise, especially walking, resistance training, and stretching, improves sexual performance more reliably than any supplement. Addressing testosterone decline, even mild testosterone drops affect drive, energy, and performance. Reducing inflammation, blood vessel health equals erection health. Anti-inflammatory diets and sleep improvements often help more than pills. managing stress and performance anxiety. For many men, this is the hidden factor. Occasional use of clinically proven ED medication. These are effective because they target the physiology directly, not indirectly. Natural remedies work only when the ED is mild. For mild cases, beetroot, citrulline, or combination products may help, but they are not cures, and they're not reliable for men with moderate or persistent ED. So, do nitric oxide supplements improve sexual performance after 50? They might help a little in mild cases, but they are not the miracle solution they're advertised to be. For many men, the underlying issues are deeper. Circulation hormones, metabolic health, stress lifestyle, aging blood vessels, nitric oxide boosters play one small role, and often a very inconsistent one. If you're over 50 and noticing performance decline, it's far better to understand what's actually happening than to rely on flashy supplement promises. This video is for educational purposes only. Talk to a licensed health professional for personalized advice.